For American Heart Month, we wanted today's webinar to be focused on cannabinoids and cardiovascular health. You may be familiar with the wide-ranging benefits of cannabinoids such as CBD when it comes to conditions such as epilepsy, cancer, behavioral disorders, movement disorders, and more. But accumulating evidence is also suggesting that cannabinoids such as CBD may be beneficial to the cardiovascular system as well. Today, we are going to discuss briefly what the endocannabinoid system is and the role of endocannabinoids and cannabinoid receptors as they relate to our cardiovascular function, the therapeutic benefits that have become realized with certain exogenous cannabinoids, what research tells us about these benefits as they relate to cardiovascular health, and then how to contact Realm of Caring for more information, and finally that brief Q&A. So far, research has been complex, and there is some overlap when considering cannabinoids and cardiovascular health, as there are multiple effects that can come from various cannabinoids. So before getting into cannabinoid research and benefits, it is important to to first have an understanding of the endocannabinoid system itself and the role that it has on the health of our heart and our blood vessels. So, our endocannabinoid system is the largest neurotransmitter system in the body, composed of endocannabinoids, cannabinoid receptors, and metabolizing enzymes. Endocannabinoids are arguably one of the most widespread and versatile signaling molecules known to man, and two key endocannabinoids that have been identified are AEA and 2-AG. These endocannabinoids activate different receptors throughout the brain and body called CB1 and CB2 receptors. The CB1 receptors are found in high levels in the brain and the central nervous system, whereas CB2 receptors are found in numerous immune cells, tissue, and the peripheral nervous system. The modulation and activation of the cannabinoid receptors by these endocannabinoids can have various effects. The role of endocannabinoids in heart health has been demonstrated through several studies. So first, we understand through research that endocannabinoids are released in large amounts by white blood cells and platelets in certain inflammatory conditions. Subsequently to this action, these endocannabinoids exert their actions on heart and vascular cells, leading to the dilation of blood vessels, also known as vasodilation, which lowers blood pressure and slows the heart rate, also known as negative inotropy. Next, we understand that endocannabinoids relax coronary and other arteries as well as decrease cardiac work. They also act as a stress response system. And then lastly, we have learned through research that endocannabinoids have been shown to decrease the risk of developing cardiac arrhythmia, an effect that is mediated mainly by CB2 receptors. So all of this research leads us to recognize the role of endocannabinoids as largely protective of our cardiovascular system and our bodies in general. Here is an image that more clearly illustrates the roles that the two mentioned endocannabinoids AEA and 2-AG can have on CB1 and CB2 receptors. Through interaction with these receptors, the endocannabinoid system regulates overall homeostasis. So it is important to note through this that in one study, which was supported by others to follow, it was found that CB1 receptors have the potential to actually be pro-arrhythmic if overwhelmed by endocannabinoids. We want to consider endocannabinoids as the good guys throughout cardiovascular pathology, but this small clinical trial showed elevated levels of endocannabinoids in the plasmas of individuals with arrhythmia. This research has further led to understanding the actions of potential exogenous cannabinoid antagonists and modulators and their role in maintaining homeostasis. We're going to touch on this point again here in just a moment. Researching the roles of endocannabinoids on our cardiovascular health has further led researchers to look into exogenous cannabinoids and potential benefits. Targeting the endocannabinoid system offers fresh insights to how cannabinoid therapy may benefit conditions such as hypertension. Cannabis may have multiple effects on the cardiovascular system, just as endocannabinoids can have actions that increase or decrease blood pressure and heart rate, different phytocannabinoids can replicate those same actions. For one, THC taken in certain quantities may stimulate heart rate or blood pressure. CBD, on the other hand, may reduce heart rate and blood pressure, as well as improve vasodilation, reduce inflammation, and reduce vascular hyperpermeability. The pharmacokinetics of cannabis and its compounds are greatly dependent on the route of administration, the specific cannabinoid, and physical characteristics of the individual administering the cannabis. We're going to take a little bit of a deeper dive into CBD specifically as it relates to our heart health. CBD is short for cannabidiol. It's a phytocannabinoid found in cannabis and hemp with a varied and complex mechanism of action. CBD is well tolerated and it is a partial agonist rather than a binding agent to CB1 and CB2 receptors, acting as an allosteric modulator within the endocannabinoid system. This is to mean that it may directly influence or modulate the effects of an agonist on a receptor. So when it comes to CB1, the receptor that has the potential to be proarrhythmic, as mentioned previously, CBD is a negative allosteric modulator, which means that it may reduce the efficacy and the potency of the endocannabinoids, as well as the phytocannabinoid THC, by reducing the recruitment of these cannabinoids to that CB1 receptor. This is the reason behind CBD blocking some effects of THC by preventing the molecule from binding to CB1 receptors in the brain. This is also the reason behind the ability of CBD to potentially be anti-arrhythmic due to its preventing ample amounts of endocannabinoids to overwhelm CB1 receptors, ceasing those pro-arrhythmic actions. CBD has been researched for the many ways it may benefit our heart health. Some of the most notable therapeutic actions of the molecule are the anti-inflammatory and antioxidant properties. Being that vasculitis, acid reflux, coronary heart disease, high blood pressure, type 2 diabetes, and stroke may all be linked to inflammation, CBD may have a protective effect in preventing these conditions. In animal models of stroke, CBD has been shown to reduce infarct size and increase blood flow. Much like the action of endocannabinoids, CBD has shown to reduce the cardiovascular response to models of stress. Stress, as we know, can spike blood pressure, heart rate, and stroke volume. In studies done with healthy volunteers exposed to stress, it has been found that CBD may maintain cardiac output by lowering blood pressure, increasing heart rate, and decreasing stroke volume, which are inversely related actions to balance that cardiac output. When considering diabetic individuals, cardiovascular complications are the leading cause of morbidity and mortality. Results have strongly suggested that therapeutic potential of CBD when it comes to diabetic conditions by attenuating oxidative stress, inflammation, cell death, and fibrosis. Likewise, to diabetes, oxidative stress occurs in the myocardium or muscular tissue in heart disease individuals. The antioxidant benefits of CBD have been studied to prevent or decrease oxidative stress by blocking excessive levels of glutamate. Oxidative stress is also linked to vascular damage or damage of blood vessels and endothelial dysfunction, which is coronary artery disease where the large blood vessels constrict instead of dilate. Just as with many conditions that CBD and other cannabinoids may benefit, there is plenty of room for more research. We are pretty limited in terms of clinical data to speak to the full therapeutic potential of phytocannabinoids like CBD when it comes to heart conditions or prevention of heart conditions. And medical professional advice is always recommended by us at Realm of Caring before beginning cannabinoid therapy, especially if you may be on pharmaceutical drugs for your condition. However, if you do have any questions about cannabinoid therapy itself in terms of administration methods, researched benefits, quality product suggestions, etc., we at Realm of Caring are here and happy to help. To learn more about these researched effects, make sure you do visit our research library. And while you're there, you can participate in research as well that we have with Johns Hopkins University. If you want to be a part of the largest cannabis research registry in the world, you can find your baseline survey in your account under research and then the observational research registry. Participants may have opportunities to receive coupons for free or discounted products from supported brands. If you do want to reach out to our care team to discuss anything cannabinoid therapy related one on one, we are here for you. You can email or call our care team directly or head to our contact us section to schedule an appointment. Here is our information on how to contact us. And also make sure that you are following on social media or you're on our newsletter.